The Female Pelvic Medicine Reconstructive Surgery Fellowship is special in that it is truly an integrated fellowship with urology, and thus the fellows have the opportunity to learn about gynecologic urology from both gynecologists as well as urologists.
By having a truly multidisciplinary and collaborative experience, you're able to really get the best of both worlds. And this allows a fantastic learning opportunity for the fellows because there's no singular one way of doing things. We have all the tools in the tool belt.
I came from a great gyne-based residency program with excellent urogynes there, but the urology component here is incomparable.
One of the other really nice things about our fellowship is that our fellows get a broad exposure. The depth and breadth of what they see in the surgical procedures they do is really amazing. Not only do they see sort of the routine, as we'll call it, female pelvic medicine conditions, but they'll also see complex reconstructive procedures in patients.
One of the greatest opportunities of coming to UCLA to train is the competence of our faculty, the warmth and family-like nature of our training programs, and really the access to an extraordinarily diverse and wonderful community of academics all throughout our campus.
Here at UCLA, the FPMRS physicians are doing really innovative research. We have a full-time director of research, so we'll have translational research opportunities for our fellows as well as clinical research opportunities.
The way our fellowship is structured is kind of like an apprenticeship model, so you spend a dedicated amount of time with each attendant in the program. You really get to sit with them in clinic, go over patient care, ask detailed questions, and it becomes more than just a working relationship. It becomes a true relationship of, mentor and mentee. It's important clinically just to be exposed to different patient populations. So we have the opportunity to rotate between a county system, so all of you, the Santa Monica Hospital, as well as the Reagan campus. We do see a variety of different patients in different clinical settings, including the county system, which is very unique for a fellowship program.
Once one leaves our program at UCLA, one's going to have the skills and the tools to really go into any practice setting that they like.
As I'm getting into my last year, I'm getting more and more focused on finding a job, and knowing that my attendings are really well connected and know good people nationwide, that's very comforting to me.
The fellowship program in FPMRS at UCLA is fully accredited by the ACGME, so all of our fellows, upon completing their fellowship, should be eligible for FPMRS certification by either American Board of Urology or the American Board of Obstetrics and Gynecology.
I chose UCLA because it was a great opportunity to work with experts in this field. Dr. Nidhi is world-renowned, and he's also the past president of SUFU. Dr. Roseman, who's also led the OGS program, which is another pillar in this community. Part of my interest in actually coming to UCLA as well was my underlying interest in global health. So I was born outside of the US, and Dr. Tarne is a lead surgeon in Uganda, and he has developed a fistula program in one of the teaching hospitals in Uganda.
At UCLA, we have a global health experience, and we are able to go to Africa, go into a different country, go into an entirely different health system to see how an entire different community lives and works is a tremendous opportunity. And it's even a privilege to actually go and be trusted to take care of this really deserving group of women. And so I think it's a touchstone for fellows. It's a life-altering experience, and I think it's that kind of experience that's really rewarding.
I'm proud to be a part of this program because I'm going to come out well trained. I'm going to have people I can call when I need help that I know will be honest with me.
I've learned so much in terms of how to approach the same problem from a gynecologic perspective that I would not have otherwise experienced had I not been in this program.
I think that any fellow that comes to UCLA should know that they have 100% support of all 7 of the core faculty members, as well as the rest of the faculty in the departments of urology and obstetrics and gynecology.
The culmination of that results in really just an excellent place for patients to receive care and an excellent place for fellows to come get their training.
Looking back now 3 years in, and it's like you're married to somebody, you know the good, bad, and the ugly, I would come here every time.
You see yourself.
You see yourself.
Healing the world.
You see yourself here.
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 UCLA
Female Pelvic Medicine and Reconstructive Surgery.